This afternoon, we learned that 3 Ohioans have tested positive for COVID-19. From what we see around the world and in the United States, this disease will, for a period, significantly disrupt our lives. We would urge people to use common sense. Where possible, avoid crowds, certainly avoid large crowds. My commitment to the people of Ohio is that we will continue to inform you of exactly what we know in Ohio, what is taking place. This is, as I said, certainly an unusual time. Most Ohioans were not alive when we've had anything similar to this, or certainly many Ohioans were not alive. We have activated, at 1 p.m. today, we activated our Emergency Operations Center. Again, that is expected. We knew we were going to be activating it at some point. It now allows us to better communicate and have everybody in one location. We received approximately 1,000 calls this weekend, so we encourage people, if they have things that they need to ask, is 1-833-4, as in the number, ask-ODH. So that's 1-833-4-ASK-ODH.
And so as this situation evolves, it's becoming increasingly clear that there is community spread. We're watching. I'm working with my colleagues in each state. We're talking every day. I'm talking to the federal government, to the White House. The governor just had a call for all governors. We're getting the latest information, but we as a state in Ohio are leaning in and taking aggressive approach. So increasingly we're knowing that the older you get, the more at risk you are. Younger people seem to be even less at risk than the flu, but we know that our seniors are most at risk, and those are the groups we're reaching out to now. So people who are hospitalized, people who are elderly, also at risk are people with chronic diseases, so people with heart disease, lung disease, people who are severely overweight, people who are immunocompromised because they're taking maybe drugs for a cancer. These are the folks that we, in particular, are speeding up the testing on and prioritizing because we know they're most at risk. Our healthcare workers are also at risk, and we're taking unprecedented measures to protect their safety through our partnerships with hospitals, with nursing homes, with long-term care agencies. We've learned from history, and we've studied pandemics, and I do call this a pandemic because in my mind, it definitely meets the criteria of that when we see this sort of community spread. The actions we take today and in the days to come here in Ohio will make our lives a little more uncomfortable. You'll be hearing guidance on travel, on visiting your loved ones. We don't want you visiting your loved ones in a nursing home if you're sick. If you live with someone who's in one of these high-risk groups, you should treat yourself in a household as a vulnerable household. Don't just think about the one person. One of the things Dr. Fauci just said to me on a phone call was, when you are in a household with someone who is at risk, treat yourself as if you have the disease and take the same precautions. And that's how we can protect our most vulnerable. So much more guidance will be coming, but people do need to know that it won't be life as normal in this country for a while. And we will be leaning in and asking businesses and everyone to cooperate as we give guidelines for what's best for Ohioans.
We are from Cuyahoga County. All 3 individuals are in their 50s. One couple was on a cruise on the Nile. One of them has been hospitalized, one not. The third person, unrelated to the first 2, went to APAC conference in Washington, D.C. So those are the essential facts that we have at this point.
What the initial data is seeing, and if you look at a World Health Organization study that just came out, I have the graphs but not on me, literally you can watch it climb up the age ladder. So the flu, we've often said that the rate of our mortality is being around somewhere around 0.1. We said that this disease, people are saying between 1% and 3%. We know that SARS was worse, MERS worse yet, and so we have this sort of scale. We have to realize this. If you are 40 to 50 years old, and if flu is 0.1, the numbers in some of these preliminary studies are 0.4. And folks are starting to do the math on this. And they're saying that means that middle-aged people are at a much higher risk than they are for the flu. And I think you'll be hearing some of these numbers come out shortly. And so that's very, very important. I'm going to explain something. It's a little bit complicated, but the data on these countries like Italy, even South Korea, are lagging because by the time a case is diagnosed, it's going to be sometimes on average 9 to 12 days before that person is hospitalized if someone turns for the worse. Deaths from this disease are being delayed by 3 to 6 weeks. So we just don't know enough yet. But we know that it is increasingly risky the older you get, and if you are already having health conditions. And again, we're talking about a respiratory disease. And for people at home, again, most people still will do well. They'll ride this out. But for some of the high-risk groups, you should contact your doctor sooner than later, even earlier in the illness if you're in the high-risk group. If you're elderly, if you're in this group of high-risk people, or if you're a healthcare worker that has been in contact with someone suspected or known, or someone with that travel history, you should talk to your doctor sooner than later in your symptoms.